Hello, I'm Dr. Joel Becker, founder and director of Cognitive Behavior Associates, and I'm here to tell you a little bit about the cognitive behavioral treatment of bipolar disorder. This is one of a series of videos on our YouTube channel that are meant to educate the public. First and foremost, when we think about bipolar disorder, we do think of it as a biological disorder. Even though the direct heritability of bipolar disorder has not been demonstrated, and in fact in monozygotic twin studies there is not a direct 100% correlation between people who have the same genes and people who would get the disorder called bipolar. In fact, to the best of our knowledge at this point, bipolar disorder probably is the result of multiple genes and multiple gene combinations. That being said, the first line of treatment for bipolar disorder is medication. Working with your psychologist and your psychiatrist, patients can come up with a very effective regimen for the management of their emotional states. In recent years, we have looked at what does the addition of cognitive behavior therapy do in the treatment of bipolar disorder. Recent studies that have come from UCLA and the Massachusetts General Hospital have shown that the addition of a cognitive behavioral component can accomplish a number of things. Number one, people who add cognitive behavioral therapy, and I might add also some family therapy to their medication treatment, have over the years fewer episodes of bipolar disorder or mood swings. Those episodes are shorter and they're often of less intensity. So there is certainly a role for the addition of this psychosocial aspect in the treatment of bipolar disorder. What does the treatment from a cognitive behavioral perspective for bipolar disorder consist of? I would speak about three essential characteristics. The first characteristic is helping patients to identify early warning signs that they may begin to be cycling. One of the first aspects that is very helpful from a cognitive behavioral perspective is an exercise that we do with patients helping them to identify the early warning signs of cycling. Patients are asked to identify for them what would be early signs that they might be becoming depressed, or what might be early signs that they might be becoming manic. As a function of identifying those signs, patients are then taught things that they can add in or take out that could influence the severity, the intensity, or even the occurrence of that cycle. For example, if a patient is identifying a sign that they could becoming manic-y, we might suggest that they certainly not listen to a lot of rock and roll music, but instead listen to classical music or otherwise keep the level of stimulation down. That's just one example of many helpful strategies that we can suggest as a function of the early warning signs exercise. A second very important aspect of the cognitive behavior therapy for bipolar disorder is the education of patients about the nature of circadian rhythms and how those affect mood cycling. What we have found in the research is that patients who suffer from bipolar disorder are more sensitive to disruptions in their circadian rhythms than are patients who don't have bipolar disorder. So helping patients to design and then try to adhere to the most regular daily schedules with regard to sleeping, eating, etc. is often very helpful in helping patients to control or regulate their moods. A third very important part of cognitive behavior therapy for bipolar is the addition of a family therapy component. Research has shown that when you educate the significant others in our patients' lives, that they can be helpful both to help the patient to identify those early warning signs and also to help them to be careful to maintain their circadian rhythms. This brief overview has just touched on the highlights of the cognitive behavioral treatment for bipolar disorder. If you'd like to order a CD that contains much more information and a complete description of the CBT for bipolar disorder, please visit our website at cognitivebehaviораssociates.com, and you can email us from there. Thank you very much for listening, and we hope you found this helpful.